Tiffany. This is a countdown. I think we're probably about 32 to 34 days down. Yep, see you guys in September. Okay, let's go ahead and get started. Good morning. I'm Serena Benton from Georgia, and I want to start with introducing our speakers for today. We have two speakers. Our first speaker is Jaslyn A. Grouillon, MPH. She's a project manager too at Wake Forest University School of Medicine's Department of Implementation Science, where she leads operational capacity building, workforce development efforts in the Precision Health Research Lab. She oversees multi-state genomics education and precision health research initiatives, manages multidisciplinary teams, and develops training programs that strengthen research, workforce capacity, and implementation effectiveness. With more than a decade of experience in public health, clinical research, community engagement, and program management, Jaslyn has worked across academic, healthcare, federal, and global health settings and is dedicated to advancing health equity through research, education, and innovation. Welcome, Ms. Jaslyn. Next, we have Sarah Covington Cobb, MSPH, MSW. She's a program manager with a Center for Community Health Alignment and brings more than 20 years of experience in public health project implementation, research coordination, workforce development, and grant oversight. Sarah has facilitated the Preferred Genomics course for CHWs 3 times in English and is currently helping prepare the course for its first Spanish language cohort later this year. Congratulations, Sarah. Okay, before we get started, if you have not, let's give a hand clap to our speakers for today. Come on in, give us your name in the chat, your state, whether you are CHW or an ally. Speakers, you have the floor.
All right. Good morning, everyone. Thank you all for joining us today. I'm happy to be here. And thank you so much, Serena, for those wonderful introductions for Sarah and myself. So let me get myself oriented and I will share my screen. And we will get started. All right. Can I get a thumbs up? Can everyone see my screen?
Yes.
Okay, perfect. All right, everyone. So thank you again for joining. Thank you for the thumbs up. I appreciate it. Love the engagement. All right. So today we'll be discussing the Partnering to Build Understanding of Genomics Responsibility, the Preferred CHW Research Education Program. So with that, I want to jump into the purpose of the Preferred CHW training program, which is to address the unmet need of developing a network of CHWs with competencies in genomics to enhance diversity of the entry-level genomics research workforce and to support diversity of participants in genomics research. During this presentation, we will cover the development of the training, the ongoing delivery of the program, and our preliminary evaluation of the program. So I know the big question. So why should we be concerned about CHWs in genomics? A diverse genomics research workforce is required to achieve the promise of genomics for all. As trusted members of the community they serve, CHWs are in a unique position to enhance genomics workforce diversity and collaboration within their communities. Additionally, there's anticipated to be rapid growth of the genomics workforce over the next decade. In engaging the active CHW workforce within the Southeastern United States, we can promote diversity in the genomics research workforce and support the engagement of diverse population in genomics research. Okay, so in order to achieve these goals, we're going to first need the design. We first needed to design the training, actually. So now let's do an overview of the Delphi process. So we used the Kirkpatrick model. We also had some quantitative assessments And we also did qualitative assessment. So as you can see with the Kirkpatrick model, it was the experience with each module in the training, learning what the learning was, what was learned as part of the training. For behavior, we focused on changes in behavior following the training and results, longer term impact of training. So the quantitative assessment, we looked at all these different, I won't go through each bullet point, but making sure the module has clear objectives, making sure that the length of the training was appropriate for the materials to be covered, as well as sequencing of topics appropriate and the course content. In the qualitative assessments, we had focus groups and, just asking questions concerning how can we improve a participant's response to the training, or how do you think participants will learn from the training, what skills they can improve. So the training curriculum for the Delphi process, the training curriculum was designed through a 3-round Delphi process that included input from key stakeholders, including genetic content experts, CHW trainers, and CHWs. So 86% of the 20 Delphi process participants were CHWs and or CHW trainers. So this approach ensures that the training is directly applicable to the CHW workforce. That was our center focus. So the initial curriculum was developed based on the 10 key genomic competencies and the 10 initial modules on workbook activities, and the practical application projects were initially assessed in round 1, a virtual survey centered on the Kirkpatrick model. So each item was assessed for the clarity, the application of adult learning theory, and overall effectiveness. And round 2 took place in the form of 2 groups in which participants discussed the findings from the first round and made additional suggestions. And then overall themes in this round included the need to emphasize the integration of the CHW role, the need for expanded genomic condition coverage, and simplified content and technical terms. So using round 1 and 2 findings, the curriculum was adjusted accordingly and then reassessed in round 3, which was delivered just like round 1, but with the updated curriculum. So using the results from round 3, any remaining gaps in the training were identified and the curriculum was revised a final time. So the Delphi process themes that we found, strengthening the emphasis and connection to the CHW role, also simplifying the clinical and scientific language, so making it more understandable, as well as expanding real-world application of the content, like having applicable resources and strategies, expanding genetic content coverage, application of adult learning theory, and then the appropriateness of accompanying workbook activities. Okay, so just to provide some more information about the Delphi process, on the left is the initial curriculum we began, and on the right is the revised content. So to assess the individual modules, we analyzed percent agreement, for which the cutoff was 75%. So the modules with the asterisk in red are the modules that had lower than 75% agreement and were the weakest overall. So additional changes were made based on free response feedback and focus group feedback. So resulting in the final curriculum consisting of 10 modules divided into these 3 blocks, and then the final project, the practical applications project. So since the inception of the preferred training program, we've actually had a total of 3 large cohorts. We had the summer 2025 cohort, as well as the fall 2025 cohort, and we just wrapped up our spring 2026 cohort. So our 2026 cohort was our largest cohorts, and we'll get into that data a little later. But we had 6 cohorts under the 2026 cohort, led by various sites within the Southeastern United States. With cohort 1 being led by the Center for Community Health Alignment, cohort 2 led by the North Carolina Community Health Worker Association, Tennessee Community Health Worker Association also had a cohort, Cohort 4 was led by the South Carolina State University. And lastly, we had two cohorts that were actually led by the University of Southern Mississippi. And so now we're going to talk about the final curriculum and training delivery, and I'm going to hand it off to my co-presenter, Sarah.
Thank you, Jaslyn. So that's how we got to the curriculum. So what does the final curriculum look like? Is you go ahead to the next slide. This is how it looks at the end. We have four synchronous sessions. Synchronous meaning live, like we actually facilitate live and in person. Asynchronous sessions, asynchronous content is videos that they can see and watch, and then workbook activities that they do between the synchronous meetings. And then there's a practical application project. So go ahead to the next slide. The next three slides are, I just wanted to give y'all a flavor of what the workbook looks like. So this is part of what they do in between the synchronous sessions. Here's one about how to collect a family health history regarding some of the more common genetically linked cancers. Go ahead to the next one. These are some case studies around genetic counseling and testing and how the CHW can engage with that process. Go ahead to the next one. And this is a little bit about how we do genetics research. So we all had to find an example of some genetic research that's going on and talk a little bit about it in the workbook, and then we reflected on it in the session. I did a little bit about how I found a study when I was doing my first cohort about some people who are genetically at a higher susceptibility for an eye condition, and how those people who have that genetic susceptibility should not drink instant coffee because there's a risk of associated with enhancing your susceptibility to that cancer if you drink instant coffee. So we learn a lot by looking at real world applications of these genetic studies. Go ahead to the next one. And then the fourth session, everybody has to do a practical applications project, either by themselves or in a group. And we assign like 4 hours to this practical applications project, and it's their opportunity to be creative. However, they can apply what they've learned about the relationship between the work that CHWs do and genetics and genomics is fair game. So I'm going to share with you some of my favorite practical applications projects that we've had in my cohorts. Go ahead to the next slide. Oh, yeah, and we have a rubric for evaluating them. So the facilitators and their other people in the course evaluate all the practical applications projects according to this rubric. So on the left, some folks from the most recent cohort did a interview. They interviewed somebody who works for the Juntos Against Cancer program about hereditary cancer. So they did a really nice interview and put it up on YouTube, and we could all watch that. On the right was a discussion section that somebody designed, a discussion model that somebody designed about helping people understand the relationships between genes and your health, genetics and your health. And they came up with this wonderful comparison. They said, imagine that you're building something with Legos and the instruction booklet is your genes, and they tell you where to put those Legos. I thought that was really cool. Go ahead to the next slide. Just some more examples of how genetics and genomics turn up in what CHWs here in the community. Somebody did a discussion with Greenwood Genetics, an interview, excuse me, with Greenwood Genetics about the relationship between genes and certain psychiatric conditions. Shout out to Toki Dunn down in Alabama, who did a discussion structure for CHWs that had this catchy title, OMG Nomics, which is so wonderful. And then mock patient interactions for CHWs around genetics. So those were some of the my favorite creative ways that some of our learners were able to create a practical application of what they're learning around this. And now I am tagging Jaslyn back in.
All right. So now you guys had a chance to understand like how we designed the curriculum, the flow of the curriculum, and the final practical applications projects. So now we're going to talk about the evaluation. So like how we evaluated the training. So our training participants, so part of our evaluation, we had pre, post, and 3-month surveys that we followed up with to assess their knowledge, but we also did qualitative interviews as well. And so just some of the participant reported motivators included various things. So participant motivations to join the course included the desire to learn about genetics, improve as community health workers, also improve healthcare for their community members and learn about health research. The course goals reported by the participants included learning about genetics, gaining new skills to better serve their communities, and improving their ability to share the benefits of research within their community. So as I stated a little earlier, that we had 3 big cohorts, summer 2025, fall 2025, and spring 2026. And as you can see progressively that each cohort where we had more and more people and we had to we had to increase the number of cohorts as well too. So we had 88 eligible applicants, 42 completed in summer 2025. Fall 2025, we had 128 eligible applicants and 65 actually completed the course. And then in spring 2026, we had a major jump with 381 eligible applicants and 126 completing the course. So to date, a total of 14 cohorts have completed the training and 233 CHWs have completed the entire training. So no, this is a lot of data, but I'll just synthesize it as best I can. So in 2026, we had over 400 applicants. Half of the applicants applied from other states. And originally, it was more centered to like North Carolina, South Carolina, Tennessee, but this year we had people participating from New York and Texas. But the other majority were from North Carolina, South Carolina, Mississippi, and Tennessee. Primarily female, primarily Black or African American who actually applied to be a part of the program. Age range was very vast, so from 20 to 60, with a few actually being above 60 and below 30. So the distribution appears to be like fairly even, like across the range, with a concentration mainly in the mid 30s to late 50s. So overall, the data set has seemed to represent a really diverse group of individuals, but primarily adults covering young to older age brackets. So, and then we additionally some more preliminary data continued. So we had extended originally the invitation to 240 eligible applicants with 40 per cohort for with the 6 cohorts. We had 207 complete the pre-survey, and we ended up about 30 to 40 trainees in each cohort. The initial sessions were well attended, and once again, we had 126 that completed the spring 2026 course and 233 who had completed the preferred training across all 3 of the larger cohorts. And so this is just kind of just reiterating, just broken down in table format of what I've already stated in regard to our 3 cohorts. So as you can see, primarily female, primarily Black or African American, primarily non-Hispanic or non-Latino. And as you can see, South Carolina, well attended. We had a lot of South Carolina participants. So circling back to what I stated earlier about the evaluation process, we had the pre-course survey for the trainees where we covered, it was a demographic survey, but also we covered genetics literacy and genetic testing. And then immediately after the course was completed, we sent out our post-course survey. So circling back to the genetic literacy survey and genetic testing survey, so to assess their knowledge and see what knowledge they've gained. We've also had the self-efficacy scale, the Kirkpatrick model, and rank order of preferences. At the end of our post-course survey, we did ask if they would like to participate. It was an optional post-course qualitative interview. And we actually had a total of 39 interviews that we done across the training. And with that, it was just a one-on-one focus group that was a one-on-one interview actually with the CHW trainees, but then also after the training, we had focus group interviews with the CHW trainers. We would have like an evaluation debrief. And then for going back to the trainees who completed the course, we will also distribute a 3-month post-course survey. So 3 months after completing the training, came back to them, assessing their knowledge on genetic literacy survey and the genetic testing surveys to see, the knowledge that they've maintained post-course. All right. And a lot of this, though, the evaluation process is really informed by the REAIM framework, which includes like an in-depth look into the reach, the effectiveness, adoption, implementation, and maintenance of the program. So we did have examples up here of each one. So like for reach, how can we improve the reach of prefer? Effectiveness, did prefer improve trainees' competence in the key learning objectives? For adoption, how confident are the trainees in the genomics competencies? Implementation, how well was the CHW training delivered? And maintenance, do trainees maintain knowledge learned from prefer? And also our qualitative interviews were highly framed around this framework as well too. So I'll just kind of give some preliminary findings. So in the immediate post-test, participants were more likely to agree with the following statements. My genetic test results could give my family members useful information about their risk of inherited diseases. Or either the statement, I would obtain genetic testing for inherited diseases now so I can avoid future problems. And lastly, I would encourage my family members to get genetic testing if I tested positive for inherited disease. And participants were more likely to disagree with the following statements. I'm worried about the cost of genetic testing. I am concerned that my health insurance might not cover genetic testing, and I don't have time to go through genetic testing and follow up appointments, excuse me. So as you can see, these are all had significant responses. And the qualitative interviews from the summer cohorts, like those wrapped up. And we had, like I said, we had a total of 39 interviews. But as you can see, these are quotes that people that I thought that were impactful that some of the trainees shared. One stating, being aware of the importance of sharing family history and being able to take that information to community has just been a blessing to me. Or the last bullet, I feel like the material that they provided us with was very digestible. And like I said, it was very easy to learn level, and it just helps me understand it. So I feel like I can help use it for somebody else to help them understand it too. All right. And Sarah, I will hand it back to you to wrap up.
Great, thank you. I had 3 reflections I wanted to share as part of the wrap up. The first is look at the size of this team. Look how many people are on there, and a lot of these people are on this call today on this meeting. It's a big team, and it was really awesome, really wonderful. The PI, the principal investigator, and the institution team really facilitated an excellent process for developing and implementing this project. It allowed us time to get to know each other, build trust with each other, and really learn a lot from each other. I learned so much from all of the people on this slide, and I really appreciate that. And I think it strengthened the program. A lesson learned for me in participating in this is just the value of bringing together awesome people and building time and intention in the collaboration process to enable that kind of really rich growth. The second reflection I wanted to mention was this Delphi process that Jaslyn explained. It is so cool, y'all. I had never heard of it before participating in this, but what I learned and what I kind of took home from this project is the Delphi process is kind of a structure that it's kind of a structure for the nothing about us without us ethos. It made sure that everything that went into the prefer process was informed and responsive to the CHWs that we were hoping to engage in that process in the project, and the subject matter experts that we needed for making sure it was accurate and really well, aligned to the profession and the subject matter. So, and again, like Jaslyn was saying, this Delphi process was a really nicely structured way to collect and document and respond to that input and make sure it was really tightly aligned with the needs in the communities. So I got really jazzed just to learn that this thing exists, and to learn more about it, hopefully in the future, and to use it in the future. And the third reflection I wanted to say is that this network, the Southeast CHW network, is amazing. When we engage this network, the meeting that you're on right now it helped us recruit participants, share the information, spread the word about this project and this process. And really, once we engaged the network, the implementation of this project went into overdrive. So I would tell you, whatever y'all are doing in your work, and whatever you are hoping and dreaming of doing, engage with this network. It is really powerful, and it's a force for positive good in our region. Um, we had just a wonderful experience working with the network. So can't say enough about recommending that you do that, and also thanking the leadership and the organization behind this network. So that's it. Those are my three reflections. I do lots of shout outs to Marie in the chat. She is awesome. How many hours total is the training? It is 4 synchronous sessions of 2 hours each. And then there is assigned work to do in between the sessions. So we actually got it, I think, in South Carolina. I will double check, but I believe it's accredited for 20 hours of continuing education units. I'm going to double check oh, there you go. Jaslyn already is on it. All right, that's all for us. I don't know if we have time for questions or discussion.
Okay, I did see a couple of questions pop up in the chat, and I think you answered them. Anybody else have a couple of questions before we move on to our next agenda item? Okay, no questions. That means you, Jaslyn and Sarah, you had an amazing presentation. Thank you for the tag team. We really enjoyed this, learning about the 3-round process of the preferred CHW training and genomics. It was really good to know and to hear that the CHWs were used in the process of creating this program. And I wish you more success, especially when you begin to complete and present the Spanish version of this program. And shout out to the CHW network. I mean, you guys are amazing. And I like the thing you said at the end, nothing about us without us. That is great for all of us to take with us through our daily walk with our community health work. Thank you again, Jocelyn and Sarah.
No, thank you for having me.
Okay, let's move on. We're going to turn it over to Soledad for our committee updates.
Hello, good morning, everyone. So happy to see you all. We have a full team here. Thank you for the presentation. And I want to share, what I'm here to talk about, what I am pushing, what's happening in almost a month, like Sarita mentioned, about 34 days or so, that we will be in Greenville, South Carolina. The summit is coming, the countdown. So check your emails. We will love for you to join us. I'll say right now, let me see in the chat. or in emojis, who's coming to the summit? Who is going to be there in the summit? Who is coming to Greenville, South Carolina? Okay, I see a lot of emojis. I see, yes, yes, you'll be there. Awesome, awesome, wonderful. So one thing I do want to say before I move on that the hotel rooms right now are completely booked, right? But this is what I'm going to do. In the chat right now, I'm going to put a link that if you would like a room, this is not for you. This is not a booking link. This is for us to know how many rooms we need to open up because the deadline technically is supposed to be the 21st, but since we're booked, right? We're trying to see if we could get some more rooms just so you can get that opportunity to get the summit discount that we've negotiated with the hotel and also, be in the same space, right, with everyone else. So once the 21st hits, so we're going to meet with the hotel shortly after this meeting to get more rooms, but we need to have an idea of how many rooms we would need. So if you did not book a room just yet, fill out this link so we can get an idea. If you could do that right now, that would be amazing. Just so we can get an idea, and then we will email you that they added more rooms to our list. So reserve your room. They're not taking any payments right now. You will pay once you're there. So this is to reserve your room. We are completely booked, but we're looking to see if we could add more. Okay, but we'll stay in communication with you because we are collecting your email address for that. Okay. So I just put it in the link. I just put in link. I just put it in the chat. The link is in the chat. Okay. So what I'm going to do right now, I'm going to share some photos of past summits photos that you can look at as I am speaking. Okay. So join us this next month for our sixth annual summit presentation. We have some amazing, great presentations for you. We have the breakout rooms coming. We have, different activations. There's a lot that we have planned, and we are looking forward to seeing you. When I tell you our breakout session speakers, they are ready. We have some great topics. Our panelists, we're going to do so much to share and just continue moving this workforce forward and in the same time networking and just having a great time with everyone who is there around us, right? So I do see a question. Yes, Latanya, you are welcome to. Yes.
I just had a question. If your room is already booked, do they have accessibility rooms available?
They do.
Okay.
Yes, absolutely. You can call the hotel and just let them know what you're looking for. Yes.
Okay.
Mm-hmm. Yes. And we will have our poster session as you see in the video um um on the screen right now. And not only that, we're honoring CHW's in South Carolina. So the next link I'm going to put in the chat is going to give you everything. Okay. Where those of you who, if you are a CHW in South Carolina, we want to honor you. See, these are our CHW hometown heroes in Atlanta when we was in Georgia. So we want people to know who are the CHWs in that state. Okay. So we sent an email out. We want more people to join us. Okay. And we have an amazing lunch sponsor at Perion who will be doing something super amazing. I don't want to tell you, I don't want to give it all away. All right. There's some things I gotta save until we are in person. Okay. So you gotta join us in person to know what we have for you. Okay. So I will put the link that has everything, including the CHW Hometown Heroes for South Carolina. And if you for you to register, we are completely booked for rooms, but there's the link in the chat um for you to, if you would like a room, we'll send you an email. And also another thing we're booked on would be exhibitors. We have no more room for exhibitors for the summit. And that's that, we got a lot of teams, we got a lot of people coming. But we are booked for exhibitors. So that means all of you that are coming, there's gonna be a host of information that you get to leave the summit with knowing so much of the other organizations and what they're doing. So just give me like a minute or so and a couple of seconds, and I will put the link that you can see everything else. Okay. Thank you.
Thank you, Soledad, for that update. Okay, we will now move into our monthly updates for our states. So I'm going to call out the state name, and if we have a representative, please just give us your update. And I do have the time clock running, so um let's hear from, let's try to keep it 5 minutes tops. Let's hear from Virginia first. Do we have a representative from Virginia, the state of Virginia, for your updates?
You're still on mute, Stephanie. Good practice.
Thank you.
The
Hi, we
improvement.
do. Thanks, Stephanie. My name is Stephanie Carrington. I am from the Virginia Community Health Workers Association. I am I am the engagement director here. A few updates about us. We are having our second cohort of community health worker training for the deaf and hard of hearing. So that's been really exciting. We also have a mini grants or scholarships where we're gonna bring 3 community health workers to the Southeast Eastern Network Conference. So we're excited about that. We'll soon, this Saturday, we'll have our CHW Day, CHW Family and Friends Day at a park. We're gonna have a cookout for CHWs to come together and network. And we are also having our annual conference with the doulas on October 8th and 9th in Culpeper. So we are excited about that and we welcome you guys to join us.
Thank you, Stephanie. And if you
Thank
want
you.
to
I
add a
was looking at
link,
your time clock.
I appreciate that.
I will add a link in the chat. I
Thank
will add a
you.
link in the chat.
Thank you. Okay, let's move over to Tennessee. Do we have a representative for Tennessee?
Yes, good morning.
Good
Can you all
morning.
hear me okay?
Yes.
All right. And I'm Nikayla Boyd, Executive Director, joined by Laurie Hoffma, our Director of Operations, and then Bree Burke. I don't see her yet, but I'm sure she's here. She is our Program Manager. Just a few updates from Tennessee. So, CHW Week next week, National CHW Week, we are going to have a kickoff celebration this week at our monthly member connect meeting on Thursday, August 20th at 11:30 a.m. Central. We'll have games and prizes, and members are going to share stories of their successes over the past year and their CHW Week activities they planned. And we'll also connect and share stories from our CHWs on social media and throughout the week. APHA. So Tenchwa will be presenting on program accreditation that Sunday afternoon. We're excited and we invite anyone attending APHA to come join us and hear about program accreditation if you missed it when we presented on it here in May. And also, we're happy to be proud to be one of the preferred partners. And I think they mentioned earlier that we have presented a couple of cohorts, and we're excited that they're going to have a poster at APHA. And so we'll be present there for that. And it's going to be on CHWs, of course, and genomics education. We are recipients of the Southeast Community Health Worker Network mini grant, And so our grant is focused on supporting membership and engagement as well as convening CHWs. And so we're doing this through our monthly member meetings. We've increased engagement with SCCHW in activities, including this monthly meeting. I see a couple of our board members, maybe 3, 4 are here, and some of our CHWs from Tennessee. It's usually me and Lori, so we are really excited to see, and Almetria. We're excited to see so many Tennessee representatives here today. And our training program. So through our funding from United Healthcare, we have expanded access to CHW training and certification opportunities in Tennessee. We have about 15 people enrolled in our training now, and they're going to be finishing up next week. And our next cohort has over 30 people registered and is already full. But we are developing our 2027 calendar. And that will include both regular enrollment and scholarship opportunities that we're going to release. So we'll share the final calendar and application links broadly so that CHWs and organizations that employ CHWs are aware of the upcoming training opportunities. Program accreditation. Tentua has completed its 3-year program accreditation pilot. We presented on this in May. The pilot has since ended, and this is through our partnership with TennCare, our state Medicaid office. And so this gave us the opportunity to develop, test, and refine our standards. We're now moving into a 1-year transition and evaluation period to assess the pilot, incorporate lessons learned, and our plan is to launch the actual program in 2028. So we're going to extend the pilot a little bit on our end and then launch it to the general public in 2028. Hopefully, we're working with evaluators now, and hopefully we'll be able to come back to a Southeast meeting to share what we found. Rural Health Transformation Funds. So those opportunities in Tennessee are being released almost weekly, usually on a Friday. We encourage Tennessee organizations to monitor those opportunities closely, and apply for the programs that align with their work. CHW programs and CHWs might not be explicitly identified in those requests for proposals, but it could trickle down. So please keep an eye open, and apply where you see fit. And you can find this information on the Tennessee Department of Health website. And finally, we are partnering with the Tennessee Charitable Care Network to provide a CHW section at their annual conference in September. It's going to be September 14th and 15th in Nashville. The conference includes 3 CHW focused breakout sessions and time to network. And we will be offering credits for those who attend. And I have 24 seconds left. Haha. And so we're going to put in the chat the link to the registration, and I can give y'all 15 seconds back.
Thank you. Thank you.
Thank
Okay,
you.
let's move on. She's going to put information in the chat. So, guys, please watch the chat. Thank you for keeping up with the time. We're going to move over to Arkansas. Do we have a representative?
Morning.
Good morning.
Morning, everybody. I'm Judy Pyle. I'm from Arkansas Community Health Worker Association. Nice to see everybody this morning. We do have 3 online webinars coming up we wanted to invite you to, and I'll run through them real quick, and then I'll put a link in the chat where if you're interested in registering, they are free, and you can receive a certificate of attendance if you would like for our webinars. The first one is in September. It is about vascular disease with a physician at University of Arkansas for Medical Sciences, and it is geared for community health workers. The formal title is Everything You Need to Know About Vascular Disease, and it is on September 8th. Usually our webinars are on Tuesdays at 2 p.m., but that's Central Time, so you might have to adjust that an hour or 2 depending on where you are. We also have our monthly webinar in October, on October the 13th, also a Tuesday, and it is on Maternal Health 101 for community health workers. We have a lot of maternal health initiatives in the state of Arkansas. Our governor is very interested in that. So just an overview of what's happening in Arkansas on maternal health and community health workers. And then at the end of October, we are partnering with the Arkansas Department of Health to do a diabetes webinar for community health workers. And the focus is going to be utilizing the diabetes risk test. So we are going to have a panel of CHWs kind of talk through ways they are using the diabetes risk test and kind of give helpful hints and challenges that they found. So you guys are welcome to join us for any of those, and I'll put the link in the chat now. Thank you for the opportunity.
Thank you. Thank you. Let's move on to South Carolina.
Can I share my screen, please?
Yes, you should be able to share your screen.
It says I can't. So, oh, wait a minute. Let me see. Okay. Hopefully I can figure this out. Okay. All right. Let me try it one more time. Okay, y'all. So South Carolina took our mini grant from the Southeast Community Health Worker. Oh, and I see I made an error there. It's the Southeast Community Health Worker Network. And we started an ambassador program that is really more focused around the South Carolina Community Health Worker Association. We have 10 ambassadors. Part of what we're doing is helping them develop leadership skills, increasing volunteer opportunities and leadership opportunities for them to become more active in the Southeast Community Health Worker Network, and to help us increase our membership numbers in CHW. Well, isn't this a surprise? One of the things that we've done is we've gotten a small grant from the CDC Foundation to do an outreach project in Spartanburg, South Carolina, where there were so many measles outbreaks. We have a community health worker team there, including a trilingual community health worker who speaks English, Ukrainian, and Russian, and the project there is called Connecting Together. We're doing some amazing work. It's really such an opportunity to learn about how you go into a community and learn about the cultures. I think a lot of times we think that, oh, if you're Hispanic, if you're Slavic, it is a homogeneous population. We have absolutely learned that that's not the truth. This team will be presenting at the Southeast Community Health Worker Network Summit, talking about how you go into diverse communities. And I hope that you'll join them for that breakout session. We'd also like to invite you to the South Carolina's Community Health Worker Awareness Week celebration. We have it every year in Columbia. This is going to be an amazing time. We're expecting 150 to 175 community health workers. We've invited legislators. We have a ton of sponsors who are going to be there. It's always an amazing time. Please, please join us if you can. It'll be a great day. And I hope that wherever you are, if you can't make it with us that week, I hope that you'll join us. Other things that community health workers will be doing is we know that some will be doing radio programs, podcast, just all kinds of things in their communities to celebrate. Also, this just finished, but I wanted to bring this up. This Southern Alliance for Public Health Leadership and CHW were funded by the CDC Foundation to develop a rather unique conversation about vaccines. And it's really focused on helping community health workers put vaccines into plain language and to be able to talk with folks, giving them dignity and respect, meeting them where they are around whatever it is that they believe and why, being able to come back with some factual information, and then use our motivational interviewing skills to move this conversation, hopefully to move people to take action. We just finished this. We trained about 20 community health workers. There will be many more opportunities. We'll be doing it in multiple places in South Carolina, but we'll also be doing it in Georgia, North Carolina, Tennessee. If you are interested, please let me know. I'm happy to make sure that you get in one of our next cohorts. We're also finally, oh, thank you, Lord, we are finally having launching our Men's Reaching Men. It's not us, and I shouldn't say that it's us. It's the Men's National Community Health Worker Alliance. They've developed a training program, and they are about to launch that. Please, please jump in. Oh, I see the QR code isn't on this side. Takeda, if you're here, if you can drop that into the registration, or we'll send the registration link out to you. But these guys have worked so hard on this, and we realize that reaching men is different. And so I think, guys, this will be a wonderful opportunity to us to really build up our male community health worker workforce. Also,
Terry,
yes,
we're going to have to stop you. We have one more that needs to present. So I'm going to ask you, if you can, to add your extra items to put them in the chat. And if we have a little bit more time, we may come back to you. Okay? Thank you. Let's move on to Alabama.
Hi, my name is Julian Harper. I'm with Connection Health in Birmingham. I'm a community health worker and social media coordinator. And this month, CHWs across Alabama have officially formed the Summit Planning Committee for Alabama for the inaugural Alabama CHW Summit. The full committee will be this month. As part of our committee's work, we are reaching out to Alabama's tribal communities to invite their participation in the summit and involve them directly in the process as well. We are partnering with the National CHW Policy Coalition to reach out to bipartisan congressional delegation seeking their support in 2026 CHW awareness, and to our state legislative representatives for a companion state resolution. Last year, our state legislators provided a resolution formally acknowledging CHW Awareness Week. So we have requested to do that for another year for 2026. And the same legislator who introduced Alabama CHW certification legislation has also led this legislative resolution effort. So we're really excited about that too. We are hoping to send members of the Alabama Summit Planning Committee to the Southeast CHW Network Summit next month so we can bring back ideas and help shape our own summit's implementation. And we are involved in drafting a manuscript for journal submission based on the evaluation of the HRSA CHW training grant, with the CHW serving as co-authors of the publication. We are also really excited about that. And finally, CHW representation was presented at the Voices for Medicaid event coordinated by the Institute of Medicaid Innovation in partnership with Alabama's Doula Committee. So to discuss further, we're transforming maternal health grant and the importance of doulas and perinatal CHWs together. So we look forward to that as well.
Thank you, Alabama.
Welcome.
Let's move on to turn it over to Kim.
Thank you so much, Serena. We are a little ahead of time. Thank you for keeping us moving today. At this time, we would like to launch our evaluation poll for today to get feedback on the presenters that shared today as well as the meeting. So you should now see the poll on your screen. Are you able to see it?
Yes.
Okay. All right, so we'll give you a few minutes to complete the evaluation poll, and thank you in advance for completing it and providing your feedback. And I'm going to, before I open up the floor for additional updates, announcements for folks to share, I want to give it back to Terry so she can complete whatever she wanted to share, and then you can toss it back to me, and then we'll open up the floor.
Okay, so a couple other things real quickly. Tomorrow, our collab is a program to educate, empower, and reach communities on the importance of colorectal screening. I dropped the link into it, into the chat. So feel free to register. That's open to everybody in the Southeast. We also, and you can go to our website. I dropped that link in there. We're going to be launching a training around working with individuals living with MS. We're very excited to do this. We've learned a tremendous amount, and we're partnering with the National MS Society on this. So you can go to our website and sign up for that, and we'll share more information about that later. But finally, I wanted to talk just a second about very often, I think folks don't understand the work of associations and what we do every day. So, part of what we do every day is we are working on making sure that you have a job, not just today, but in the future. We are constantly working on sustainability. We're looking at policy. We're looking at funding opportunities. We're looking at how we can help raise up our profession. And this is the work that we do behind the scenes. Uh, right now, I've got multiple projects that we're working on, multiple partnerships, and the vision is to make community health workers sustainable. So you may not always see what's going on behind the screen, but I can promise you that your associations are in the trenches every day working for you and to make sure that you're here for the long haul, that we are here for the long haul.
All right. Well, thank you so much, Terry. Just another reminder, the evaluation of today's meeting is open. We have 70 something people on here and we only have 33 completions. So please, please, if you can, fill out the evaluation for today. And thank you, Sarah, for putting that note in the chat. All right, before we open up the floor for additional announcements or updates, I want to share with you about an upcoming fun and exciting webinar that's being hosted by the network. It's Beyond Business Cards, Networking with Purpose. So please save the date. We'll be pushing this out to the listserv as a reminder as well. But this webinar is scheduled for September the 10th and it's at 2 p.m. Eastern Standard Time. So come expecting a good time to learn as well as share any best practices that you have around networking. It's going to be an exciting time. We are prepping for the summit as well as other things that CHWs participate in and can use some networking skills. This was something that you all wanted, and we are happy to bring it to you. We're going to use the open registration process again, so no registration will be needed. We're going to push out the Zoom information with the save of the date and any additional updates that will come thereafter before the summit on September 10th. All right. So at this time, we're going to open the floor for those of you who would like to share any events or updates or share any comments for the good of this group. So if you would raise your hand, we'll be sure to recognize you and give you the floor to speak. Also, please feel free to add any items you have to the chat. All right, go right ahead, Stephanie.
Hello, everybody. I'm so excited to be here. I would love for you all to help us create a compilation video. So in the chat, you'll see the link. 1 minute. We got to cut some of y'all off. 1 minute is all we need. It could be 30 seconds, but we would love for you to share one thing you want people to know about CHWs and who we are. So click that link and create your video. We're collecting those videos until Sunday, the 23rd. And then we're going to have a watch party and play some games next Friday. And so more information about that. Also, um, we would love CHW Strength will be driving to Texas for APHA. So if you are a CHW and you want us to pick you up on the way, we have a lovely camper van and can seat up to 8 people, and we're going to be driving semi-cross country to make this thing happen. And if there are some limitations with funds and you've been able to get a flight to APHA and you want to ride with us, I'm going to put my email address in the chat. Email us so that we can reserve your seat and you can join us. And so we're in Virginia. So that's where our journey will start, going to North Carolina, South Carolina, Georgia, Mississippi. This might not be the right route, but you get what I'm saying. We go MapQuest it out and we can come through and pick you up. But let us know if you are interested in joining us. It may take longer than a flight, but you're going to be in good company. So thank you so much, and looking forward to continuing to celebrate National CHW Awareness Week with each of you, and we will stay connected. My email address is coming in the chat if you want to ride to APHA.
Thank you
We
so
had a
much.
question in the chat. Will only men be facilitating the men's specialty track pilot program?
Um,
Hi,
well,
good.
I'm trying to get there. Yeah.
Yes,
Okay.
that is correct. For this initial cohort, we want to really strengthen our male presence in this space. And so we are focusing on our male facilitators at this time. However, that's not to say that we may not be opening it up to all CHWs in the future.
Thank you so much, Stephanie, and Takeda. Does anybody else wish to share?
Kimberly, there probably aren't 5 people who haven't yet signed up to come to Greenville, but I am so excited. This will be, this is the one nobody's going to want to miss. So I hope if you're on the fence about this, I hope you're going to be there with us. It's going to be full of surprises and an amazing, amazing time. Please come to Greenville.
Yes, please come to Greenville. Thank you, Terry. And also, I'm dropping in the chat. Someone requested it as a private message, but I'm going to put it in the chat for everyone. This is the QR code for today's evaluation. If you're not able to get the pop-ups on your computer or if you're on a cell phone device, this is the QR code that you can use to complete the evaluation. We are now up to 51 of 70 some people. So continue to complete the evaluation for us, please. Would anyone else like to share?
I'll put the link in the chat. I don't know if y'all already know, but hopefully we'll see you on Monday at the NATUA's kickoff meeting for CHW Awareness Week. But that is happening at, don't quote me on the time. I want to say 2 p.m. Eastern Standard Time, but I'll put the link in the chat so that you can join that. There's some things happening in person in several locations to include Chickahominy Health District as well as Portsmouth Health District to celebrate CHW Awareness Week. On Wednesday, we're going to have a lunch and learn. I'll try to get that link in the chat too. But if not, check us out on Envision, right? We've got an Envision app. All these things hopefully are going to show up there because I can't click all the things that fast. But I'll make sure to post it in there if I don't get it in time before we close out. And then next Friday, I mentioned the watch party and some games that we'll be doing for CHW Awareness Week. So lots of things on the horizon. Stay engaged, stay connected for sure.
Thank you, Stephanie and Miss Andy put in the chat confirming that the webinar is or the kickoff is at 2 p.m. Eastern Standard Time. All right. If no others wish to share at this time, I'm going to turn it back over to Serena for closing comments. And thank you so much, Serena, for facilitating today's meeting. And just a small plug here, if you are at CHW and you are interested in facilitating one of the monthly meetings or multiple monthly meetings, please let us know. Let us know, and we'll get you everything you need, your full agenda, bios. We give you everything that you need. So please, sign up to facilitate. Thank you. Back to you, Serena.
Thank you. And thank you, everybody who reported out for your state. I want to remind you that the meetings are third Tuesday of the month from 10:30 to 12 p.m. Eastern, 9:30 to 11 Central. And our next meeting is September 15th, 2026. The topic is to be announced. So look out for that coming through your emails. And again, thank you, CHW's allies and friends, for logging into our meeting today. If I will not see you in the community, I hope to see you in September. And remember, we are one network, many roles, shared commitment to community health. So everybody enjoy the rest of your week. Bye-bye. And click on everything you need that was reported in the chat. Thank you for joining us. Enjoy the rest of your week, everybody.